treatment problem. Dr. Sarah Henn specializes in treating immune-compromised patients with HIV and AIDS. Henn says on a weekly basis she encounters bacterial infections, that is, in patients that are resistant to the first line of antibiotic treatment. She also expressed concern about the rise of a potential superbug.
Earlier this week, U.S. health officials reported a Pennsylvania woman with a urinary tract infection was resistant to a last resort antibiotic. Health officials expressed concern that the superbug could pose serious danger for routine infections if it spreads.
We risk being in a post-antibiotic world, and that wouldn't just be for infections that you think of as bad infections, pneumonia and urinary tract infections. That's bad enough. That could be for the 600,000 Americans a year who need cancer treatment.
Thomas Frieden, director of the U.S. Center for Disease Control, says the bacteria was resistant to colistin, an antibiotic that is reserved for use against nightmare bacteria. The infection was reported in a study. The superbug itself had first been infected with a tiny piece of DNA called plasmid.
Now, if this colistin-resistant gene becomes widely prevalent in these types of infections, we won't have anything left to treat.
Dr. Henn says because the woman's infection did respond to treatment with another antibiotic, while the threat of a superbug is growing, it's not yet dire.
I don't think we should be scared, but I think we need to be proactive. I think we need to think about how we're developing new antibiotics and how we use the antibiotics we have.
States antibiotic resistance has been blamed for at least 2 million illnesses and 23,000 deaths annually. Experts have warned since the 1990s that bad superbugs could be on the horizon, but very few drug makers have attempted to develop drugs against them.
When we talk about these, highly potent antibiotics that can be used against superbugs, these aren't things we're going to be using every day. These are things we want to hold back in our arsenal and use only when we absolutely need to. So there's not a lot of money to be made in making something that isn't going to be used routinely. And so I think, as a society, we have to think about how we want to address that.
Frieden says the need for new antibiotics is one of the more urgent health problems as bugs become more and more resistant to current treatments. But many drug makers have been reluctant to spend the money needed to develop new antibiotics, preferring to use their resources on medicines for cancer and rare diseases that command very high prices and lead to much larger profits.
We'll take another short break, but I will return shortly with your news headlines and all